Hello, students, and welcome. Today's topic is mental health and substance abuse policy. So, yet another in a long line of policies and concerns that we have for our country in terms of the populations that we serve. And so today we're just going to do some highlighted look-throughs at mental health policy and substance abuse in terms of looking at some of the dynamics and the highlights that just kind of take us into this particular domain. So let's get started. So as you can see here, in the early 20th century, um, the National Mental Health Association was developed, and it was developed really around looking at making sure that the rights of the mentally impaired were actually taken into consideration. Um, in the progressive era, we were looking at the eugenics movement, which really looked at more of a philosophy of the survival of the fittest, and this notion that people who were mentally impaired need not to actually reproduce. So, as we know now, as we think back through what has transpired since then, we recognize that that's a very sinister and failed policy. 1927, Buck versus Bell was a social worker that was fairly instrumental in making the argument that when we looked across the country, there were thousands of persons who were suffering with mental disorders who were about to um, be sterilized and didn't even have the capacity to understand what the procedure was or what it even meant to them. So, 1946, the Mental Health Act was established, and it also gave some teeth to the National Institute of Mental Health. And then Dr. Robert Felix became the director and was really the primary architect of the community mental health movement. You can see here a picture of Buck, the Buck people, or should I say the Buck duo. And this is a Supreme Court case that really moved things along as it relates to the whole process of sterilization. Um, the Community Mental Health Act was signed by Robert Kennedy in 1963, and it provided for construction of community mental health facilities. Um, there was a subsequent later Community Mental Health Act that really looked at providing those essential services: inpatient, partial hospitalization, emergency services, case management, education. The funding changed in 1981 um, in terms of the moving away from the community mental health model to more and more of deinstitutionalization. And so NAMI grassroots organization developed to really again look at what was in the best interest of those who were mentally ill and their families. And then the advent of psychotropic medications as a form of treatment for those suffering with chronic and persistent mental illness all came about. We see that again, this Mental Health Act was signed back in 46 by Truman, and this gives you a little bit of a look at the percentage of people who are still mistreated to this very day due to the mental illness that they suffer. Community Health Bill passed in 1963. And when we think about mental health, some of the other implications are around that 16% of the inmates in local correctional facilities all suffer from a mental disorder. Jails have slowly replaced mental health clinics as a source of care, which is not a good thing at all. Prisons and jails are poorly equipped to deal with the needs. And then there was the Psychopharmalogical Scandal, in which the DSM diagnostic tool manual was written by a number of doctors and psychologists and social workers, and come to find out that the people who drafted this particular manual, which really kind of looks at exploring the diagnoses and treatment regimens for the various mental disorders, were actually getting lots of money from big pharma. So, totally a conflict of interest in terms of an agency that had a desire to move psychotropic drugs and then influencing people who wrote diagnostic manuals to actually be a part of that. It's problematic. Um, and I think it was at this point that psychiatry became really a captive of the biomedical model, and that, um, we're looking at pharmacology as playing a fairly significant role in terms of the treatment of mental health. And it's not all a bad thing, but sometimes the way that it evolved was problematic. The Mental Health Parity Act really then ensured that most employers, or ensured that employers, larger employers, made sure that health insurance included mental health benefits. And we've also have noticed that there is an increase in PTSD and traumatic brain injuries, TBIs, especially during the decade of the Iraqi and Civil War. So we have a number of different military personnel returning home with these ongoing mental health ailments that need to be addressed. Psychotropic meds, as I kind of indicated a little bit earlier, became instrumental in long-term custodial care to short to shorten term patient stabilization, and psych meds became much more of a routine treatment. And here's just a few of them. And in my career as a mental health counselor, I passed out all of these drugs, but also recognized that there were pretty significant side effects for a lot of my patients who actually ended up taking those as well too. And so oftentimes when you see situations where people who are on medication have decided to stop taking their medication, it's usually because they don't necessarily see a need for it, or it causes further decompensation through the impact of side effects. So it's kind of a not win-win situation all the way around. And then the other thing that was scandalous as it relates to pharmacology is that the SSR, the uptake antidepressant, those clinical trials, 40% of those clinical trials were withheld from public view. And we found out that many of these trials were an actual failure. So, again, the interest of big pharma in terms of being able to turn a profit and looking at ways to make sure that they increase their bottom line. And this slide just basically gives you a sense of the prevalence of serious mental illness in jails. So a lot of times people are locked up, and it's due primarily to their mental health and the crimes that it maybe causes them to commit. So as we kind of switch gears and then look at the relationship between mental disorders and substance abuse, we recognize that alcohol abuse affects about 2/3 of the population, with light to heavy drinkers. 48% of crime is committed by people under the influence. We have also the notion of drunk driving fatality. So people are actually ending people's lives or seriously injuring and maiming them. Parents, moms who actually drink during the course of their pregnancy run the risk of FAS, which is fetal alcohol syndrome, which is a fairly debilitating set of circumstances that little kids are born into, where they just are not able to develop as they would normally, and will have lifelong issues just due to the overuse of alcohol by that particular parent. So it has kind of ongoing effects in terms of being able to address these issues before they affect the next generation as they have in terms of FAS. Also, drug abuse, which is a little bit more harder to kind of ascertain the actual use or prevalence of it, because it's illegal and it's a controlled substance. So people don't necessarily come forward with reporting that type of activity. But these numbers that you see below are, in the millions in terms of the number of people who use these particular types of drugs. So if you think about in the workplace, in the neighborhoods, on the highways, you've got this type of drug use that's happening, and it does have an impact on public safety as well as public health. Interesting fact, 46% of homeless people have significant mental health and or substance abuse issues. So again, which contributes to this whole inability to look at housing. And so we need to be mindful of that as we are starting to think about policy solutions that address mental health and substance abuse issues. Um, SAMHSA, Substance Abuse Mental Health Services Administration, really is a primary source of funding, as well as Medicaid, Medicare, um, but not so much the substance abuse that exists in terms of the funding streams, which is typically um, done by the states and local revenues. These numbers are in thousands in terms of just kind of what's available in terms of substance abuse treatment. And so we can see across the country we have a number of different options for clients, with the latter few being probably the least desirable, and that would be jail, and that would be the emergency room in terms of treatment modalities to address those ongoing substance abuse issues. Addiction is more common than we think. Um, we've got this whole notion around 1 in 10 American has a drug problem. So that's a pretty substantial number and has implications for social welfare policy. We also, when we think about children's mental health, we think about children and we think about, pharmaceutical drugs, for example, ADHD, which is a very heavy, significant diagnosis for a lot of younger children, and they are medicated as a result of that. 1990, there were 600,000 kids that were diagnosed with ADHD, and it's now 3.5 million. People are worried that it's a really false epidemic. Foster children are diagnosed, you know, 4 times more than regular children, and I would also add that children of color tend to be disproportionately represented in the ADHD diagnosis as well. So that again is just a kind of a high level summary of substance abuse and mental health policy. So make sure you do your readings and look at the other articles and videos that will give you some insight in terms of what we can be doing or what we need to do as it relates to social policy, as it relates to these particular areas. Take care.